Evaluation of ovarian cysts and masses. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content is not intended to substitute for professional, legal, or clinical advice. We try to keep our information as accurate and timely as possible, but make no promises and guarantees. It works for your local unique situation. The course objectives, the students will be able to identify the different types of ovarian cysts and masses, particularly functional, benign, and malignant masses. Based on the ultrasound appearance, students will be able to differentiate between simple and complex ovarian cysts using point-of-care ultrasound, particularly recognizing the size, echogenicity, and internal structures. Students will be able to describe the ultrasound features that suggest malignancy in ovarian masses, such as irregular borders, solid components, and increased vascularity on Doppler imaging. Students will be able to demonstrate how point-of-care ultrasound can be used to diagnose and assess ovarian torsion, which is also a recognized feature with enlarged cysts potentially on the ovaries and absent Doppler flow. The students will be able to outline the role of POCUS in monitoring the size and characteristics of ovarian cysts and masses over time, being able to do clinical guided management decisions based on those serial ultrasounds. Students will be able to explain the limitations of point-of-care ultrasound in regards to evaluating mass and cysts, the challenges it comes with imaging, and the needs for additional diagnosis tools to get a definitive diagnosis. Students will be able to integrate point-of-care ultrasound into clinical decision-making, being able to differentiate between benign conditions and more serious ones to help with managing conservatively versus being more aggressive with collaboration and surgical management. This topic is really important because in general, point-of-care ultrasound allows nurse practitioners, midwives, physician's assistants, care providers to be able to recognize quickly on a bedside ultrasound, is it a cyst, is it a mass, what's going on, and then you can make quick decision based on those results versus you have to send them out to radiology and wait for that ultrasound to be done and interpreted and sent back to you, and depending on how busy their schedule is. So especially in urgent care, triage setups, and in a clinic in a rural setting, having point-of-care ultrasound for gynecological concerns, particularly pelvic pain and ruling out ovarian cysts and torsions, is really important. Most cysts are benign, but you can have complications with those cysts like rupture, torsions, and malignancy, and it's important to be able to accurately interpret the results of your ultrasound findings. Early detections with point-of-care ultrasound improves the outcomes, gives you timely interventions, monitoring changes closely with those cysts and malignancies, being able to determine if you need to do surgery versus conservative management on a quick decision. In those situations with ovarian torsions, you need to have quick diagnosis, and it can be life-saving. So in an emergency department, it's very important that you have competent, qualified clinicians that can do point-of-care ultrasound to make those quick decisions. There's many different ovarian conditions, and the ones we're going to focus on are cysts and masses in today's presentation. Ovarian cysts are common fluid-filled sacs, often resulting without any symptoms, but you may get them large. They may cause some twisting and some pain, but many people just don't know that they have them. Point-of-care ultrasound provides accessible, non-invasive, real-time evaluation of ovarian cysts, and you can keep a close eye on them to make sure that they rupture, they're shrinking in size, or staying the same. There's different types of ovarian cysts. There's functional cysts, which is the most common, usually benign, results from ovulation. And this also includes the follicular cysts, which occur during the immature follicles, and then the corpus luteum cysts, which occur after ovulation. There's also pathological cysts, and they can be benign and malignant, such as endometriosis, dermoids, cystadenomas. There's a lot of different types of pathological cysts, and you need to be able to at least determine, is it fluid filled, is it solid, is it more prone to be malignant versus benign. There's certain features you'll notice when you're doing a point of care ultrasound. A simple cyst is going to be more oval, round, anechoic, smooth-walled, and benign. Usually, if it's less than 5 centimeters, it's going to be benign. You just watch it. But if they're larger, it increases pain, it increases the risk of a torsion. So the significance is you want to be able to, based on their symptoms and based on findings, make a decision quickly. Is this something that needs to be followed up quickly? It's more complex, malignant prone versus benign. Complex cysts are going to be more having septations, they're going to be solid filled, they're going to have internal echoes, they're going to indicate more likely pathology. And so you want to be able to determine, okay, this is something we can check on and follow up in a couple of weeks, or no, you need to refer to an obstetrician and more of an aggressive management because of the suggestions that your ultrasound is showing. So with endometriomas, the appearance is more of a glass ground shape, and they're going to have an ultrasound texture from those old blood deposits. And the dermoid cysts are mixed echogenicity with fat, hair, calcifications, making it very distinct on an ultrasound. The whole point of a point of care ultrasound is to do timely assessment. You have a patient comes into your clinic, they're having pelvic pain, right-sided, left-sided, generalized pelvic pain. You want to be able to quickly look at their ovaries, look at their fallopian tubes, look at their uterus, and determine, is this something that they should just keep an eye on? There's nothing we can find. There's some concerns. We need to send them to the urgent care. I need to grab the obstetrician down the hallway. You need to be able to, as a nurse practitioner, midwife, physician's assistant, be able to know how to deviate and get, is this more likely benign and just needs to keep close eye on it, or is this more serious? And symptom management, are things getting better? Is it a large cyst? Is it a small cyst? What type of cyst it is? It will really determine at the bedside, real time with the patient, what's the next step of plan. Ovarian masses, there's many different ones. There's more suspicious ones that you need to keep a close eye on, and then when you're thinking cyst and benign, but you definitely with masses and unknown, a lot of mid-level providers will just instantly get a referral in a couple days with a higher specialist because it looks suspicious on your ultrasound. There's different types of masses. The benign ones are more serous mucus filled, and then the malignant ones are more often diagnosed, unfortunately, late. They have markers of irregular borders, solid filled, and lots of vascularity. So you're going to notice on a Doppler flow lots of blood flow to those ovarian masses. Here are some key features on an ultrasound with ovarian masses. If it's more benign, you're going to have well-defined borders, smooth, regular margins, homogeneous echo texture. So you're going to have more of solid tumors like fibromas appear uniform, may even be hypoechoic. You're going to have no internal vascularity. There's going to be minimal or no blood flow on Doppler inside of that ovarian mass. Things that are more malignant are going to have irregular borders because it is suggesting an invasive growth. Solid components, mix of echogenicity, especially postmenopausal, and then there's going to be lots of blood flow based on the Doppler studies that you do. Ascites, you're going to have free fluid, tends to indicate more of an advanced condition. The whole point of the point of care ultrasound with ovarian masses is to determine, is this more benign suggesting, or is this more of malignancy of concerns? Risk stratification, what is the pain? How long has it been going on for? Has there been past ultrasounds? Do you have a baseline of the size, shape, discomfort? In surgical planning, you're going to refer to the obstetrician and have a baseline. Your ultrasound is going to be really helpful for them to determine how quickly they need to be seen and evaluated, and then they can track the changes. If they can't get in with the obstetrician in 2 weeks, they have your baseline size, location, composition to go from to help to determine how quickly it's growing. So sometimes when you have large masses and cysts, you can get ovarian torsion, which is a medical emergency. The blood flow is being cut off to the ovaries, based and that fallopian tube based on how it's twisted, but it causes extreme pain and it needs to be evaluated immediately. So this would be more of an urgent care situation, emergency room. Someone comes in with severe pelvic pain and you need to evaluate quickly. Especially in rural settings, you may not be able to get the ultrasound tech and the radiology department to see them right away, grab the ultrasound machine down the hallway, and quickly determine if there's loss of blood flow to the ovaries based on that ovarian torsion rule out. So there's key features. You tend to see enlarged ovaries swollen due to edema, congestion from that reduced blood flow. Absent blood flow is a key diagnosis because of that compromised circulation. You'll actually may or may not see the twisting of the ovaries. And so it just depends on which type of torsion is occurring. The key thing is you want rapid diagnosis. You want early detection. You don't know they're coming in with pelvic pain. You want to determine, is it appendicitis or is it a GYN concern, because you're going to have to quickly get a general surgeon versus a gynecologist, obstetrician to do the surgery. And so that bedside ultrasound will really be able to help you determine where exactly is the possible situations, especially with an ovarian torsion. You're going to get that reduced blood flow. And so there's challenges if you're nervous, you're anxious, you're not skilled and qualified, haven't done ultrasounds in a long time, you're a medical student, you're a resident, you're going to have a lot of challenges with the quality based on the operator, limited resolution based on their obesity, the location of their ovaries, their pain level. If they're all over the place moving, you need to be able to visualize well on the ultrasound. Being able to determine between cystic and solid masses is a huge component when you're evaluating cyst, ovaries, torsions. You have to know, is this benign and it can be followed up and kept a close eye on, conservative management, or is this solid, more prone to malignant, concerning symptoms? You need to follow up more closely quickly. So the whole point is to really just, what are the common things that a GYN office, particularly midwives, nurse practitioners, physician's assistants, are going to have to deal with in the clinic or an urgent care setting when it comes to gynecological concerns. So with ovarian cysts, you could have torsion, you could have masses, you could have benign or malignant lesions. Based on your findings, you can always ask someone for assistance, but we are that first line imaging modality to determine, is this something that needs quick diagnosis or can this be conservative management based on suggesting it's benign versus malignant.